in. Joshua and Bianca, I hope you are set, because Florence will be calling you in soon. We'll start whilst other people join. Yes. So that's great. We've got somebody from Pakistan. You are welcome. That's wonderful. All right. So Florence, we hand over to you to steer the affairs.
Okay. Good morning, good afternoon, and good evening to all of you here this afternoon, morning, or evening. I think we are just seeing others joining. We are going to just give them maybe 3 minutes so that we can get started. You are all welcome. We give 3 minutes and we start to be sure that everyone has been let in. Thank you so much. And after this beautiful melody we've just gotten with information about AfriHealth, I want to take this time to welcome all of you to this great session of today. I am Manju Florence, and I serve as the supervisor for the Women's Health Program of the Cameroon Baptist Convention Health Services. And I'm happy to be able to be the moderator for this session of today. And I want to really welcome you to this great session. As we all know, October is the Breast Cancer Awareness Month, which we commonly call Pink October. And we are going to be discovering many things that we need to do, not only during the Pink Month, but even beyond the Pink Month. Like I said earlier, you are all welcome to this great webinar. You are highly honored, and we are grateful that you are here. One thing we must know is that in October, it is a time that we really want to create awareness about breast cancer. It is a time that we want to honor the lives of millions women and even men who are affected by breast cancer. And it is equally the time we want to reaffirm our global commitment to equitable access to care and improve survival rates for all. As we all know, this year, we have our team from the World Health Organization, which is every story is unique, every journey matters. And one thing that I want to highlight here is that with this year's team, it helped us to recognize the diversity of the experiences, and it also helped us to reinforce the need for compassionate, timely, and quality care for all, regardless of our geography, regardless of our income, regardless of our background. The goal for this month is to promote awareness, to increase awareness about breast cancer. And the reason we want to increase awareness is to help us to be able to promote behavior change so that we can be able to detect breast cancer at an early stage. We are all here today for this virtual breast cancer awareness campaign, which we are going to be talking under the theme, Beyond the Pink, Empowering a Generation to Act Against Breast Cancer. We really count on you to be one of those people who will be able to be empowered so that we can be able to kick breast cancer out. This session has been made possible by is the African Forum for Research and Education in Health, and this is being made possible by the Student Association. We also have the Midwife Yvonne Foundation and the OncoBridge Foundation. So if we are here this day, it's because these people have seen that we are here. So not to take much of our time, I would just want to welcome our able leads for these student organizations or student associations so that they can give us an opening or a welcome remark before we actually get to our session. So I'm going to be welcoming at this time. Maybe before I get to welcoming our people for opening remarks, I'm going to give some few household instructions. So please, I will only encourage that if you are not talking, let your microphone be on mute so that it will not interfere or disturb the conversation. So at this time, I'm going to be calling on all of us to put our phones on mute. Thank you for putting your microphones on mute. I will also be encouraging that if you have a question, please, you can always raise your hand, especially at the Q&A session where we are going to have, and we are going to give you the chance to talk if you can be able to unmute your phone and talk. But if you cannot, please feel free to write in the chat. But we will also want to know where you are joining us from by getting to know you on the chat. Please write your name and where you're coming from so that we get to know you better. And like I said, if you have questions, let us know right on the chat. With this said, I also want to encourage that if your bandwidth is not very good, I'm saying so because my bandwidth is not very good. So I will encourage that you put off your camera so that you can be able to get us well and participate fully. We really also encourage active participation. Please feel free to contribute or to ask questions when it comes to the question and answer session. And with all of this said, I'm going to be calling on our brother Joshua Christopher Chukwu, who is the president for the African Federation of Medical Laboratory Science Students Association, to give us a brief welcome remarks. Joshua, you are welcome.
Thank you so much. Thank you very much. I really appreciate. Good evening, everyone. My name is Chukwu Joshua Christopher, and I'm the president of the African Federation of Medical Laboratory Science Student Association, in short form, AFAMSA. So, good evening once again, distinguished speakers, partners, colleagues, and all participants joining us from across Africa and beyond. It is with a great pleasure that I welcome you all to this breast cancer awareness campaign, organized by AfriHealth, AFAMSA, OncoBridge Foundation, and Midwife Vione Foundation. Today's event themed Beyond the Pink, Empowering a Generation to Act Against Breast Cancer is more than just an awareness session. It's a movement to educate, empower, and inspire action among young people. So health professionals and communities across Africa. Breast cancer continues to claim lives unnecessarily, not because it cannot be treated, but because too many cases are detected too late. So as future medlab scientists, future medical doctors, future pharmacists, nurses, I urge you people to share this responsibility to strengthen early detection, promote screening, and fight misinformation. So I want to sincerely appreciate our partners with this opportunity, AfriHealth, OncoBridge Foundation, and Midwife Vienna, for their unwavering commitment to health education and community impact. Thank you very much to everyone. We look forward to learning new things today. Thank you. Over to you, the moderator.
Thank you so much, Joshua. It is really encouraging to see you, who is the lead of the Student Association, coming out with things like this. We are so grateful to have you, and we really appreciate you for all your work that you have been doing. And we pray that things will go well so that we can really see that breast cancer is actually a history or something that we can get it very early and be able to prevent many women in Africa, which is our continent. At this time, I'm going to be calling on Sarah Matsikira. Please excuse me if I didn't call it well. So she is the lead for the AfriHealth student community. Sarah, you're welcome.
Thank you very much. Good evening, everyone. Good afternoon, everyone. Let me switch on my camera. So my name is Bianca Sarah Matsikira. I recently graduated from the University of Zimbabwe, and here today I'm serving as the AfriHealth Students Community Trainees Forum Lead. On behalf of AfriHealth Students Community, we organized this webinar on the theme of Beyond the Pink, where we are trying to empower a generation to act against breast cancer. So I'm delighted to welcome you all. Thank you so much for sacrificing your time. To all participants today, we are looking forward to learning new things. So our theme today it is helping us to move beyond symbolic awareness. We need to make meaningful and life-saving action on breast cancer, because as you know, breast cancer affects millions of women, even males and families across Africa and globally. Yet many lives are lost due to late detection and lack of information. So we are the generation which have the power to change this narrative. As the Afri House Trainees Forum lead and also representing the students community, we believe that as young health professionals, as students, and as advocates, we represent the generation that will transform breast cancer outcomes in our communities through education, early screening, breaking the silence around the disease, and everything. We can save lives. So thank you so much. This campaign brings together midwife Yvonne and African Federation of Medical Science Students Association, as well as AfriHealth. Thank you so much, Bridge Foundation. So thank you, and we also thank you for the commitment to health equity and community empowerment across Africa. Thank you.
Thank you so much, Sarah. Truly, we have to change these narratives, and we are that generation.
Yes.
We can be able to do this change. I'm so grateful for you. And at this time, we are
Yes.
not going to waste most of our time, but I want to let us know that this Sarah and Joshua, they have spoken on behalf of a big team that worked with us to come out with this. So they are not just two persons, but I also want to acknowledge all of you who were there to see that this is coming to reality today. Thank you so much. So at this time, I want to let us know we have two people who are going to speak to us this evening. The first one, we have a speaker who is going to take us on our team, and we are going to have a live testimony from a cancer survivor, where she's going to be sharing with us her story, and we are going to see how she had to navigate the whole story or the whole issue. And at this time, remember, our team is Beyond the Pink, empowering a generation to act against breast cancer. That is our team, and at this time, I'm going to be introducing our speaker, who is no other person, but our speaker is Dr. Stephen Kapsi, who is a clinical oncologist at the Sweden-Ghana Medical Center. Dr. Stephen Kapsi is a clinical oncologist at the Sweden-Ghana Medical Center, just like I've mentioned, one of the leading private cancer centers in Ghana. Before joining the Sweden-Ghana Medical Center, he worked at the National Center for Radiotherapy, Oncology, and Nuclear Medicine at the Korle Bu Teaching Hospital for 6 years, including his residency training period. He has extensive experience in the multidisciplinary management of solid tumors and is deeply committed to improving access to quality cancer care in Ghana and across the region. Dr. Patsy, his professional interests include radiotherapy, systemic therapy, and patient-centered approaches to cancer management. Can you join me? Welcome Dr. Stephen to this great session. Doc, you're welcome.
Thank you very much. I hope you can hear me. I will turn off my video shortly so that the audio is not interrupted. All right, thank you very much. And then good afternoon to everybody who is on the call. Can I be heard, please? Can I confirm whether you can hear me?
Yes, we are getting you 5 on 5.
All right, thank you very much. So first of all, I want to thank the African Forum for Research and Education in Health, and then the African Federation of Medical Laboratory Science Students Association, Midwife Yvonne, and OncoBridge for this platform to share information to share some learning with all of you on breast cancer for today. So I'll be using this overview. All right, so for most of us, when we hear about breast cancer, what comes to mind is usually about the pink ribbons, the sharing of flyers and information that happens every October of every year. However, there's a lot more to it, because behind the pink ribbons, there are the real stories of our mothers, of our sisters, and our brothers and fathers, who, most of them who go through treatment, go through a lot of stress, and unfortunately, some of them lose their lives as a result of breast cancer each and every moment as we talk about the pink. So we'll go through this overview. Now, why are we talking about breast cancer today? It's because breast cancer happens to be one of the most common cancers. In fact, it's actually the most common cancer in women globally, in Africa and in my country, Ghana. And it's the leading cause of cancer deaths in Africa in the most recent GlobalCan 2022 data. And the other concern is that we've noticed that the incidence is actually increasing sharply. If you look at data from 2008, 2018, and then in 2022, these are all the reasons why we are so much concerned about breast cancer. Now, another issue that comes up about breast cancer is because we've noticed that, you know, in the books, they will tell us that the commonest age group who are diagnosed of breast cancer are people between the ages of 40 and 50 years. However, we are beginning to notice that there are younger people in their early 30s who are turning up in the consulting rooms and they have breast cancer. These are all concerning. There are issues that we all need to be worried about. And even more importantly is the fact that early diagnosis, when the breast cancer is diagnosed very early, the outcomes are usually so excellent. It's a reason why we should all talk about breast cancer. If you look at this chart that's on the right, you will realize that for stage 0 and 1, you can see that the 5-year overall survival is quite high, above 90%. Whereas when you get to stage 2 and stage 3, and then to stage 4, it's almost like it falls so rapidly. So the concern is that when we are able to diagnose breast cancer early, the survival is so much better. The outcomes are so superior compared to the late diagnosis. Now, just to take you through a brief anatomy of the breast. So in your view is an anatomic diagram of the breast, which is a specialized gland. Men have breast, women also have breast. So it's not only women who have breast, but men also have breast. So it's very important to mention that. And then breast, in the breast, there are different structures. We have the lobules and we have the ducts. The lobules produce the breast milk, and then the ducts actually help to let out the breast milk. So let me just use a pointer to help. So if you look at these are the lobules over here, and then the ducts take out the breast milk out of the breast. And then the breasts are supported by a lot of other tissues, and then we have a lot of fat tissues as well. So the size of a woman's breast is actually determined by the amount of fat that is contained in the breast, and it doesn't affect the function of the breast. It's important to mention that before I continue. I mean, there are some abnormalities that can be noticed in the breast. There are some people who have some breast that extends into their armpit, something that we call axillary breast, and these can easily be sorted out surgically. So you can see this woman with extensions of the breast into the armpit area. These usually become a problem when the woman is lactating. Then these areas can also get engorged, and then cosmetically, it doesn't look so nice for most of the women who have to deal with this. And then to your right, you will notice that this individual has multiple nipples on their breast. In some countries, and especially in our continent, Africa, when a woman has multiple nipples, she can be branded as a witch. So it's very good for all of us for this month of October to know that having multiple nipples doesn't mean that somebody is a witch. And these can also be sorted out surgically as well. Now, moving forward, as I mentioned earlier on, there are so many structures that are in the breast, and any of these structures can undergo changes, can grow out of control and become cancerous. So as you can see in this picture, there are a lot of structures here, but at this area, you can see that these tissues are growing out of control. They do not look like the normal cells in the breast. And then this, and then that over here. So these can begin to grow and then turn into a tumor. Now, I'd like to mention that it's not every lump that is found in the breast that is cancerous. This is important because most people, out of the fear that whatever they've noticed is cancer, they are already overcome by fear and they do not make any attempt to visit the hospital. So if you look at the diagram on your right, you will realize that apart from tumors, which can be cancer at the end of the day, there are a lot of other sort of masses that can develop in the breast. Some of them are as a result of infection, like an abscess. We can have fibroadenoma, and we can have fibromatosis. All of this can occur in the breast, and these are not cancerous lesions. Whereas we have about 10 to 20% of the lumps that occur in the breast at the end of the day turning out to be cancer. Now, just to quickly go over some of the signs that can be recognized, I would like to mention that in early stage breast cancer, since we are talking about early diagnosis, since we are talking about empowering our generation beyond the pink, it's very important to realize that in early stage breast cancer, there are usually no outward signs and symptoms that can be picked out. So you pick out early stage breast cancer by undergoing frequent screening and mammograms, and then doing your self-breast examination. These are the ways that we can detect breast cancer that will likely be in the early stage. Going forward, when the disease begins to increase in size, there can be these signs and symptoms that show up, where there can be a lump in the breast. The individual can also have some changes in the color of the skin of the breast, and then there can be some discharge from the nipple, anything other than breast milk in a woman who is breastfeeding is something to be concerned about. And then we also have people in the late stages can have pain developing as a result of breast cancer. But to mention that pain is usually not a common sign and symptom of breast cancer, but it is important to know that it can be sometimes, especially in cases where the disease is getting advanced. Now, when the disease begins to increase in size, it often moves from a very tiny lesion, which initially you may not notice. Then it increases in size, as you can see in the second image. And then the third, where the disease can now begin to move to certain areas on the chest walls. In some regions, we call the lymph nodes, which can be in the armpit, or it can be around the collarbone. And then in the very advanced stages, which unfortunately we do find in women in Africa, we can have the disease in the early stages where the disease spreads to other organs like the liver, the lungs, sometimes the bone, and even to the brain sometimes. So these are very important things for us to take note of. Now, following finding a nodule, usually the individual will have to go through a biopsy, which is the only way to truly tell whether somebody has cancer or not. And then this is followed up most of the time, except in cases where the person is not fit for surgery, they will have to go through surgery. And then after surgery, they may have radiation treatment. They may also have chemotherapy. And then the individual may have hormonal therapy and then some targeted therapy. I'm using may because it's not everybody with breast cancer who will go through chemotherapy. For most people, the fear of chemotherapy just puts them off. So it's important for me to mention that it's not every individual who turns up with breast cancer who will go to all of these treatments. However, surgery is most of the time very much involved in the treatment of breast cancer. Now, the issue, breast cancer in Ghana and Africa as a whole, our main challenge has been that most of the patients that we see in Africa, in my country and in your country, if you recollect, most of them unfortunately present at a late stage. And why do we diagnose most of our cancers at a late stage? In fact, the current data that we have actually shows that about 60% and even more of the breast cancers that we diagnose come when the disease is advanced, when the outcomes are diminished, and when treatment is so intensive with increased side effects. Now, one of the main reasons why we have late diagnosis is because of fear and the stigma that's associated with it. In fact, people, the narrative that has been around has been that when somebody gets cancer, it means it's a death sentence. Cancer has been synonymous or has been made to look as though it's a death sentence. So the mere finding of a mass or an abnormality in the breast just takes off that fear in most of the people, such that the fear cripples them and prevents them from being able to present to the hospital and get the treatment that they so much need. Another very important thing to mention is the financial challenges, because for most people, to be able to even get the money to go through a biopsy or to have a mammogram, or when we talk about yearly screening, which requires money, unfortunately, most countries in Africa do not have an institutionalized screening protocol such that you have to pay for everything. And all of this includes a lot of funds. So all of this being as a result, or all of this being dependent on finances cripples a lot of people, and they do not show up at all. Another important thing for me to mention is the misinformation or the limited awareness. Do you realize that most people do not even want to mention the word breast, not to even to talk about mentioning the word cancer? And the cultural beliefs are so crippling. In fact, in most countries in Africa, there is a belief that certain diseases are not meant to be treated in the hospital. In fact, some diseases like breast cancer have been tagged as spiritual illnesses in most African countries, such that people will rather turn up in the churches, to the imams and to the spiritualists and get herbal treatment. They do go through all of this before they finally show up in the hospital. And then when they finally show up in the hospital, unfortunately, the disease may be advanced and then the outcomes are diminished. Unfortunately, too, our health systems do not help us. For example, to be able to adequately detect and manage breast cancer, we need things like mammography, where an X-ray of the breast is taken. And these mammographies help us to be able to tell whether there is any small lump in the breast, which maybe may not even be felt by the hand. But these are expensive. There are times where people have to travel long distances before they can actually get a mammogram done. And then another important thing is the pathology turnaround time. I have had patients in my clinic who, when they showed up to have a biopsy done, their pathology report delayed so much so that they just decide to switch course and then go for some other treatment. Almost always, all of these times, they do show up. Unfortunately, when they do show up, then things are late as a result of the delays that are as a result of pathology turnaround time. Another important thing is radiotherapy and chemotherapy services. In my country, in Ghana, for example, there are only 3 facilities that are equipped to be able to offer radiotherapy services. And even these facilities are struggling most of the time. So can you just imagine somebody who has to travel a long distance to be able to get treatment for radiotherapy? Unfortunately, most of them never make it to these centers, and then they settle elsewhere and get other treatments which are not ideal for them. And then we as health workers, we also have a role. We have a role to talk about breast cancer. We have a role to make the talk about breast cancer normal. We have a role to participate in awareness campaigns and to make breast cancer campaigns, go far so that people are aware of these. And then the communities, wherever we live in our communities, we also have a role to talk about breast cancer. We should normalize talking about the breast. Just to mention, I had a program in a church not too long ago. And when it was time to take questions, no woman in the congregation asked a question. because people are shy to even talk about their own breast, not to talk about asking questions about problems with the breast. So these are the challenges we have in Africa, which all of us have to wake up, sit up, and be able to tackle them adequately. And then there may also be a need for the governments and the governments in the different African countries to partner with private facilities and private individuals so as to spread out the services for breast cancer management. Now, one of the challenges we have beyond the pink is the myths. I am sure we've all heard that if you don't have a family history of breast cancer, then you don't have to be worried about breast cancer. But you see, more than 80% of the patients that we diagnose of breast cancer in our clinics do not have any family history of breast cancer. And in fact, for those who even have a family history, in the majority of them, there is no genetic linkage between the breast cancers that are diagnosed. So then the message is that you do not need to have a family history of breast cancer to be diagnosed with breast cancer. And then, as I mentioned earlier on, breast cancer is not a death sentence, especially when it is diagnosed at an early stage. I mentioned also that we are increasingly seeing young ladies who are in their early 30s turning up with a diagnosis of breast cancer. What this means is that breast cancer is not for old women and old men, but breast cancer can happen to women in all spectrums of their age, especially women who are in their 30s and above. And then also to let you know that not every lump that you find that is cancer. And before I flip this slide, to let you know that breast cancer is not a disease for women alone. Men also do get breast cancer. And in fact, about 1% of breast cancers that are diagnosed are in men. So men are also required to pay attention, to get involved when we talk about breast cancer. Now, early detection saves lives. How do we detect breast cancer early? Beyond the pink, get to know your breast. Beyond the pink, find out how the texture, the color, and then the size of your breast looks like. Beyond the pink, make it a point to perform a monthly self-breast examination. These will allow you to be able to take note or to be able to find out or to be able to detect when a new lump appears that did not used to be there. The only way to know that something new is happening is when you know what was there before. If you did not know how your breast was like, you will not be able to tell when there is a new lump. So beyond the pink, make it a point to do regular self-breast examination at least once in a month, both men and women. Beyond the pink, let's make it a point to encourage regular screening at least once in a year, especially for women who are 40 years and above. And in fact, even for younger women, if you have a family history of breast cancer. Not only breast cancer, if you have a family history of prostate cancer, pancreatic cancer, and ovarian cancer, these requires that you become a bit more vigilant and then look out for any abnormal signs and symptoms. Beyond the pink, I would like us to support individuals, to support their peers, and to help them to overcome the fear and the stigma. When I talk about the stigma, breast cancer in Africa has been made to look so spiritual, such that when a woman is diagnosed with breast cancer, it is assumed that she is not spiritually strong enough. It's the reason why she has been attacked by evil spirits. And all of these stereotypes scare our women. It makes people want to hide and not talk about what they are going through. Beyond the pink, use your voice. Talk about breast health. And then also beyond the pink, make it a point to encourage family and friends to check their breast. In fact, let me just mention, I did attend to a woman who was in her late years not too long ago. And this woman, in as much as she was so much exposed and very much educated, managed to hide her symptoms of breast cancer. She had a lump, she hid it from the family. When the lump progressed and became an ulcer, she continued to hide it from the family. Even when it ulcerated, she still hid it from the family. The only point that the family got to know that this woman had breast cancer was when she had the disease spread to the lungs and she could not breathe. This time, she couldn't hide it anymore. She had to be taken to the hospital. That was the only time that the family got to know that she was dealing with breast cancer. So let's fight the fear. Let's encourage people. When somebody shares their struggles with you, the least you can do is to encourage them, but not to pass an insensitive comment. Beyond the pink, let's organize awareness activities. Let's get involved. When awareness activities are being organized, get involved. If you are in church, the mosque, anywhere you find yourself, at your workplace, let's all get involved and make talking about breast cancer normal. We shouldn't wait for October of every year, 1 out of 12 months in a year, to talk about breast cancer. Also, can we find a way to volunteer or partner with cancer NGOs and then to enhance the awareness about breast cancer? This is something that can also help for us to spread the information about breast cancer and help everybody to hear about it. We should not limit the talk about breast cancer to only October. Breast cancer happens to people each and every day, each and every moment. Why do we talk about it only in October? Beyond the pink, don't stop sharing the information, the details that you have been sharing on your social media platforms. Continue to share them. Look for verified information and share them, and encourage other people to know about them, and encourage people to talk about breast cancer. Now, if you look at this diagram on your right, this I took from an Australian journal, and you realize that in stage 1 breast cancer, the survival is so much close to 100%. And then the same way as the diagram I showed earlier, it drops as time goes on. The message this tells us is that the early stage breast cancer has the better survival, and then we should aim at diagnosing the disease early rather than wait for it to be advanced. Now, as we speak at this moment, there are increasing advances in surgery, radiotherapy, and even targeted therapy. My encouragement to everybody is that breast cancer is not a death sentence. In fact, in the midst of all of these advances in treatments, the outcomes are so much better compared to what it used to be several years ago. And then let's encourage survivors to share their stories. When I mention encourage survivors to share their stories, I recount the case where a survivor that I worked with some years back told me that she went to a church to seek for permission to share her story. Unfortunately, the church told her that they do not have a platform to talk about a demonic disease. Unfortunately, they did not allow her, did not give her the platform, because they thought that breast cancer is a demonic disease, and they do not want to share a platform. They do not want to give their platform for such a message. These are all things that we should begin to work against going forward. Beyond the pink, let's normalize talking about breast cancer. And remember that breast cancer is not a death sentence. So what will you do going forward? Learn, know the details, know the facts, and then dispel the myths. And then share this information and then act. Support screening activities, drive awareness. When there are activities for awareness creation, join them. And then wherever you find yourself, if people are sharing myths that are not true about breast cancer, correct them, tell them the truth, tell them what they need to know, so that they do not think that whatever is being shared, whatever myth is being shared, which unfortunately most of the time is not true, they do not think that that is a fact. Beyond the pink, let's talk about these things. And remember that awareness is the first step towards saving a life. And it may even be your own, or it may be the life of somebody who is so close to you, somebody who is dear to you. It may be the life of a sister, a mother, a brother, or a father. And let's remember that men can also be diagnosed with breast cancer. I would like to end over here. Thank you very much. And then we'll take questions as time goes on.
Wow, 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 wow. This is really an excellent presentation. Thank you so very much. I have learned a lot from you, and I hope others have done the same. One of the first things I have learned here is that we need to be part of this change. And being part of the change, we need to know the fact. And when you know the fact, you should be able to dispel the myth. We have seen the different myths that he has enumerated. Many people know that breast cancer is a death sentence, but we are reminded this afternoon that breast cancer is not a death sentence. The breast cancer can be prevented if it is done early. And one other thing which has made me to feel very bad is when a survivor had to go share her story and they said it was a demonic kind of disease. I can imagine how the stigma can continue. But one of the things that we need to do is to see that we send out stigma. Thank you so much. I know there are other points that we have captured from your presentation, but we are going to be discussing them as the time goes on. And one of the things that Dr. really encouraged in his presentation is for us to see how to encourage survivors to share their stories. And this evening or this afternoon with us, we have somebody who is ready to share her story, who has been very passionate to see that people should not come maybe at a late stage if at all they are diagnosed with cancer. And this is no other person but Sister Martha Angolo, who is a patient navigator and a medical admin assistant and the coordinator of the Circle of Hope Cancer Support Group at the Cancer Association of Namibia. She has lived with a breast cancer, or she had breast cancer and she's been able to live for up to 12 years. At this time, I'm going to be calling on a Sister Martha to share her story with us. Sister Martha, you can unmute your mic and talk to us. You're welcome. Martha, please unmute your mic. Your mic is still muted.
Hello. Can you hear me?
Yes, we can get you very well. Good evening.
Sorry for the here. It's not good. The net is not good at all. Okay.
So your bandwidth is low. Maybe I just encourage you to put off your camera so that we can get you well and talk with us. Since your bandwidth is showing that it's low, please just put off your camera. It will help us to get you better. Thank you so much.
Okay. Can you hear me better?
Yes, I can get you.
Can you hear me better? Okay. A very good evening to everyone. My name is Martha Angolo. I'm seeing you from Southern Africa. Thank you, Ms. Florence, and the entire team who arranged this event. Thank you for the invitation and for your dedication and commitment to the fight for cancer. Before I dive into the story, let me shed some light about breast cancer and cancer cases recorded in Namibia in 2022. Namibia recorded 3,454 cancer cases overall, with 533 cases of breast cancer, making it one of the leading cancer in the country, according to the International Agency for Research on Cancer, through the Global Cancer Observatory data in 2022. It should be noted that breast cancer has a survival rate of 90. Early detection saves life. Here is my story of I choose hope over fear. When I diagnosed with stage 3 breast cancer, I thought my world would soon crumble. However, strong emotional support from my doctor and my family is fueled me by my determination to live, to encourage other people battling cancer. It was in 2013 when I detected an unfamiliar lump on one of my breasts. It was painless. I decided to go to the clinic and doctor referred me to the scanner. The results indicated that there is malignancy. I started the chemotherapy treatment the same day. I had 6 cycles. After 5 months of chemo treatment, I received 15 sessions of radiotherapy. After 2 months after radiotherapy, I developed another 3 lumps, which was confirmed that cancer is taken. It was confirmed that it was cancer. I went under another operation to remove 3 lumps. It was not easy. The journey was too long and it was heavy. 5 years after treatment, I was told that cancer spread to the bone, pelvic bone, and backbone. I ended up on a wheelchair and lost. It lasted for a year. After a year, by the grace of God, I gained and started working. That was a miracle. Currently, I'm in a relation for 12 years now. 12 years of hope. That was my story of hope. Though I always emotion when I'm talking about this, because it was not easy. It was not really easy. Thank you so much.
Thank you so much, Martha.
Hello?
We can hear from Martha, it was not an easy story, or it was not an easy life to take. It was difficult. Imagine you you're living with a lump that was painless, and after some time, you're told it's cancer, and that is not enough. You still get another one. The one thing I'm so happy, she said she had emotional support from her daughter and the family. And one other thing is that she has hope, and she has had 12 years of hope, and she is still counting. Thank you very much. If you've not been able to put questions on the chat, this is the time we open it up to you for questions and answers or for any contributions. Let's hear from you. Do you have any questions? Do you have any contributions? You can raise your hand and we are going to give you the chance. If you cannot unmute or you cannot talk, please write on the chat and we are going to get back to you with a response to your question or to get your contribution. It's time for question and answers. Please feel free. Please, if you have any question, if you have any contribution, feel free to raise your hand and share with us. Thank you. We have a hand from Georgiana. Georgiana, you're welcome.
Thank you. Yes, I think Dr. Akpachi talked about stigmatization, and I want to find out from Martha whether she felt stigmatized at any point when she was going through challenging moments, or she kept it secret from others.
Thank you so much.
Yeah,
Martha, did you get the question?
Thank you.
And Florence, I would like to say that if she could raise her voice, it wasn't too clear for us. So if she could maybe move closer to the her
Come
microphone
closer
so
to
that
your
we could hear.
microphone,
Yes.
Martha, so that we can get you better.
Hello? Can you hear me
Yes.
now?
Yeah, it's better.
It's better now.
Yeah.
Yes, it was not easy. Like through chemotherapy, you have to lose your hair has to come. And in our traditional, Osivambo traditional, I'm from Osivambo traditional, it's not easy for a lady to walk around without hair or with a bud. So it was not easy for me. So I had to adapt to wear wigs, though it was not really it's not my to wear wigs. So it was not easy. And then also when you stand in front of the mirror with one breast, that is also playing a role in your mind, because you think and you always like, this is for me forever from now on, with only one breast. Yeah, it was really traumatized. Yes.
Well,
Hello?
she was traumatized, and if I understand well, it means that you had to maybe sometimes just hide from people because you didn't want people to see that you didn't have hair, you are not putting on wig, which is not the usual, maybe avoiding questions from people. Why are you changing your style of hair now? You're not used to this, because people must ask questions. I can imagine what you were going through. But were there times that you thought maybe you could give up, or were there any times like that, maybe if I may ask?
Not at all, because at the beginning there, I am like that. I feel hope of us here. So I never thought of giving up, though I was on a wheelchair. I lost my sight, but I still continue to struggle with the fight. So I never gave up.
Thank you so much, Martha. I think we have another question from Linda on the chat. And the question is, how do you speak to those who believe in breast cosmetology? So, Doc, I don't know if you can say something here.
Yes, I can hear you very well.
Yes, so Linda wants to know how to speak to those who believe in breast cosmetology. I don't understand the question very well, so I get to you.
Yes, I do not get the question too well, but I suppose the person is asking about individuals who are concerned about maybe losing their breast as a result of surgery or their breast being affected. So I hope that is what the individual means. Now, to tackle that, one of the things I want to mention is that when breast cancer is diagnosed early enough, people do not have to lose their breast. Doing a mastectomy, which is the surgical removal of all of the breast, comes in when the disease is advanced. So it's a reason why we are talking about early diagnosis. Now, going forward, even in some of the advanced cases, there are better ways, especially when the lump is just one single lump in the breast. The individuals can be managed, given treatment or chemotherapy, and then the lump taken out without having to take out the whole breast. However, in situations where a mastectomy has to be done, there can be reconstruction of the breast. So I hope I've answered the person's question. Otherwise, the person can clarify the question well.
Thank you so much, Doc. Linda, is your question answered? If it is answered, you can just raise your hand for us to know. But if not, please, you can unmute or you can write again on the chat and we are going to get to you. Thank you so much. We are encouraging early diagnosis, just like we said, because with early diagnosis, it can really help those who don't want to lose their breast. So as one of the point that we are taking out from here is that people should go in for their breast screening so that when it is diagnosed early, it can be treated maybe without the breast being removed. We also have Cynthia who has this question. Please, I want to know if retained breast milk can cause cancer. Doc, this is still to you. Can retained milk cause breast cancer?
Thank you. So the simple answer is that it's no. However, retained breast milk can cause other conditions. There's one we call galactosal, where as a result of retained breast milk, it can form, there can be something like a lump in the breast, but these cannot transform into cancer. At least we do not have any evidence to show that. The person may be concerned because somebody may present to the hospital, maybe they have a lump which is cancerous, and then maybe they just stopped breastfeeding, and then they have breast milk collection somewhere, but breast milk retention alone is not been proven to cause cancer. So that is a simple answer to the question.
Thank you so much. We equally have a question from Oliver, and this is, are there any long-term effects one should be aware of? So I don't know, Oliver, if this is very clear because I don't know, maybe Doc, you understand it, but I think something is missing for us to get it. Are there long-term effects one should be aware of? So
I wish there's a clarification of the question. Is it effects related to the treatment that the individual is asking of? Now, let me answer it in that light. When it comes to treatment for breast cancer, as I mentioned in the presentation, there are different modalities that the individual has to go through. There is surgery, there's chemotherapy, and then there is radiation treatment, targeted therapy. All of these treatments do carry with them some side effects. Most of these side effects are limited or they are temporal. There are some side effects that are long-standing that the individual will have to be taught or guided to find a way of managing it as time goes on. For example, when somebody goes through radiation treatment to the breast or to the chest wall, there are some skin changes which improve over time, but there may be some changes that will persist that the individual needs to be aware of. Yeah, so to answer your question, there are some side effects that are temporal and there are a few that have to be managed in the long term. Thank you.
Thank you so much. We have Prosper who has a suggestion, and he starts by thank you for this insightful presentation. I have a sort of suggestion. I don't know if there are any other campaigns that have been done apart from breast cancer. I think it might help for other common types of cancers. It might help. Okay, Prosper, if I may just step in here, October is Breast Cancer Awareness Month, and that is why you see a lot of emphasis on the pink or on the breast, as we are emphasizing here. We have other months for other cancers, like for example, November we are going to be talking about prostate cancer. We have January where there is emphasis on cervical cancer. We have February, I think September too, where there is a lot of emphasis on childhood cancer. So I think there is a lot of awareness going on in particular months talking about these other cancers. Doc, I don't know if you have anything to add to what I have said.
Yeah, so just to say that the focus is probably on breast cancer, or it may seem we are talking more about breast cancer because of its public health effects, because it's the #1 cancer among the women in Africa and is currently the leading cause of cancer death. But we are not neglecting the others, as you've said. Thank you.
Thank you so much. We also have this question from Zimala Mabel. And she is, please, is squeezing of the nipple appropriate during a self-breast or clinical breast exams, or do we only consider spontaneous nipple discharge?
Yes, so squeezing of the nipple, a gentle squeeze on the nipple is part of self-breast examination. I add gentle because if you aggressively squeeze the nipple, you may force some discharges that did not probably exist already. So a gentle pressure or some form of pressure on the nipple will help in case there is any bloody discharge that has not come out yet. That gentle pressure may allow you to realize that instead of waiting for it to show up on its own later on. So yes, gentle pressure on the nipple is part of self-breast examination.
Thank you so much for this clarification, Mala. I hope you got it. We have this question too from Janet. Janet wants to, some people say when men suck the breast, it reduces breast cancer. How true is this?
So men sucking the breast does not reduce breast cancer. However, if a man in the process of sucking the breast of his wife also examines the breast at the same time, he may be able to tell whether there are any changes in the breast, or he may be able to tell if there is a presence of a lump that did not used to be there. And these can help the woman detect the breast cancer early and help to reduce late diagnosis. However, a man sucking the breast does not reduce the presence of cancer. Let me explain that a bit further. The reason why we say breastfeeding a baby reduces the risk of cancer and the man sucking does not reduce the cancer is because a woman breastfeeding her baby delays her menstrual cycle from resuming. And this delay in the menstrual cycle's resumption reduces the number of years that her breast is exposed to estrogen, which is mostly produced when the woman is having her menses month after month. However, that of a man sucking the breast does not result in the same effect. So that is why they are different. Thank you.
Wow, this is very helpful here. Thank you so much. We have this from Justin, who says, thank you very much for the insightful presentation, Doc. Please, I want to ask, to aid early diagnosis, is there a particular age where this screening can begin for both male and female, and can external factors lead to breast cancer? I think he has multiple questions. The first one, the age where they can begin.
We usually recommend that.
Yeah. So
Yeah,
the age.
Yes, the age, we usually recommend that you start screening at least from 40 years and above. However, I want to quickly add that this depends on your history. For somebody who has a very strong family history of breast cancer, you don't have to wait till 40 years to begin the screening. And also, self-breast examination does not begin at 40 years. It begins from the moment you hear this message. Whereas screening in the hospitals generally should begin from 40 years and above. But if you have a strong family history, begin as soon as you can. And then other risk factors. When it comes to risk factors, the key risk factor when it comes to breast cancer is being a woman. As I mentioned earlier on, only 1% of breast cancers are diagnosed in men, which means that the rest of the 99% are in women. So by being a woman alone, unfortunately, it's a risk factor. And then there are other risk factors, which has got to do with family history, previous history of breast cancer. Anybody who has previously been diagnosed with breast cancer has a higher chance of developing breast cancer compared to the general population, and hence they need to be on the lookout. And then there are other environmental factors like smoking, alcohol intake, previous exposure to radiation treatment, especially to the breast, that happened when the individual was younger. These are all risk factors that can predispose or that can increase one's chances of developing breast cancer. I hope I've answered the question.
Sure, you have surely answered the question. We have this other question from Janvier, and Janvier is, does long-term use of hormonal contraceptive increase the risk of developing breast cancer in women over 40? Okay,
so there are some data that tries to create a linkage, but the association is not so strong. So yes, there's some information as such, but the risk is not so high. So that's what I want to say about that.
Thank you. We are happy there are a lot of questions, and it shows that people are ready to go and pass out this message. The reason why people want to get clarified, maybe with the little doubts that they have, so that they can be able to give the right facts when they go out. Thank you. Keep your questions coming. The next question we have from Pelon, which says, what is the prevalence of breast cancer in women who didn't produce? Maybe those who have not put to bed, I think that is what Pelon wants to know.
Yes, so currently the available evidence shows that when a woman gives birth to her first child between the ages of 20 and 25, her risk of developing breast cancer compared to the general population is reduced by half. So that's one key thing to take note of. It's also been realized that when the woman waits to give birth after age 35, her risk is, however, even higher than the woman who has not given birth before. So there is really some association with giving birth and breast cancer. And more so, it's even more about when the woman gives birth, not just giving birth, but when she gives birth. So I hope I've given you some information. So yes, there is an association, and the risk is reduced when the first birth occurs between the ages of 20 and 25.
Wow, the risk is reduced when you put to bed earlier. Thank you so much. We have this other question which says, what is the prognosis and survival for a specific type and stage of cancer?
Okay, so I did share that earlier on. The survivor per the stage depends on several factors. For example, in the Western world where diagnosis, most of the breast cancers are diagnosed very early, the outcomes are usually very much superior. For example, I projected some data for Australia where in stage 1 breast cancer, the survivor, 5-year overall survivor is more than 90, it's almost approaching 100% for 5 years. And then as you get to stage 2, the survival is around 90%. And then stage 3, 5-year overall survival is about 80%. Whereas when you get to stage 4, the survival drops to around 30%. This story is different in Africa because unfortunately in Africa, about 60% of our breast cancers that are diagnosed at the time when the disease is advanced. So that swaps the picture sharply. And more so, most of our diagnostic apparatus are not so superior. So there are people who may be classified as having stage 1 breast cancer, when in actual fact they may be stage 4 breast cancer. So all of these factors will affect the survival at the end of the day. Thank you.
Wow, thank you so much. We have another one still from Janvier. Does obesity contribute to a higher incidence of breast cancer among postmenopausal women?
Yes, obesity does contribute. The reason theoretically is because when a woman is obese in the postmenopausal age, the excess fat, the body makes use of the excess fat to reproduce or to produce estrogen. There's something we call aromatization, which takes place in the fat tissues, where estrogen can be produced even when the woman is postmenopausal. So this excess estrogen sort of increases the woman's risk to breast cancer. So yes, it's important to maintain an ideal body weight and then body mass index. These have been shown to reduce the risk of developing breast cancer.
Oh, thank you so very much. I just want to let our participants know that we are going to be sharing this this recording of this session. Please, if you didn't provide the right email, do so that you can be able to receive the recording. We are going to be sharing the recording through emails after this. And maybe before I take some more questions, I want to indicate that we have a link that has been shared to us on the chat. Please check your chat and give us feedback about this webinar. We want to have your feedback so that we can be able to do better next time. So please check and get back to check this and give us the feedback, because we really need this feedback. Thank you so much. So I don't know if somebody still has a question. I think we still have 1 or 2 minutes that we can still receive questions. Is there any burning question, something you don't want to take back? Remember, you can talk by raising your hand, or you can put it on the chat. Okay, this shows that we don't have questions. Thank you so much, Doc. It was very, very insightful and very educative. I've learned a lot, and I know many people have learned a lot. People have really clarified their doubts, and we are so happy that this has happened. So before I will be calling on the AfriHealth team maybe to give us some closing remarks, I really want to say that if you are not a member of AfriHealth, please, you can be able to join AfriHealth. And for student community, if you are a student, the registration for the membership for students is free. You can check on the chat, you will see the link where you can join AfriHealth. And for organizations, I see many people from the Cameroon Baptist Convention Health Services. The Cameroon Baptist Convention Health Services is a member of AfriHealth, so you can join AfriHealth through the organization. Remember, your organization can equally become a member of AfriHealth, and you benefit through your organization. While we are waiting for more things, more information about how this can go, at this time, I'm going to be calling on the AfriHealth Executive Director, that is Georgiana Yeboah, to give us some closing remarks. Georgiana, over to you. Georgiana, can you get me? The floor is yours. Georgiana, you are muted. If you're talking, you are muted. Please, you need to unmute and give us a closing remarks. Thank you. Over to you.
All right. Hello.
Hello, we can
How
get
can you hear
you.
me now?
Yes, I can
All
get
right.
you.
It's raining here, so we had a challenge with the connectivity. So I want to conclude this webinar. It's really been wonderful. And I must say that at least breast cancer is not a death sentence. And it has really allayed my fear. It has allayed the fears of other people, because NASA is a living evidence to all of us. So we can see that breast cancer is not a death sentence. And I'm sure she might not be the only person. There are other people who are also there. Doc also made us aware that 1 out of every month in the year, let's create awareness. And so I would say that African student community, Africa Federation of Medical Lab Students, Science Students Association, Midwife Yvonne, Oncobridge Foundation, Florence, let's keep this our partnership and keep creating the awareness. And I'm sure we'll not do it for only breast cancer, knowing that November is for prostate cancer. We will continue to do our work. And January, we will also come back to women's cancer, which is cervical cancer, and move on with all others. I would like to say thank you to Dr. Pachi. I heard him on one of our radio stations in Ghana when he was talking about cancer treatment. And so when we decided that we needed a speaker, through that same FM station, I was able to get him, and happily he accepted to come and support our students in this wonderful awareness. And Doc, we are very grateful to you. Florence, we thank you that you also accepted to moderate, having the experience in women's health and doing a lot on women's cancer in Cameroon, in Africa, through aortic. Martha, not all survivors will come on to an African stage to talk. We have people from across Africa, and we have somebody from Pakistan also here. And we thank you so much for not covering yourself somewhere, but really being open to all of us, for all of us to know that cancer is not a death sentence. And I'm sure that all of us, our fears have been allayed. We will not also be stigmatizing people wherever we find ourselves. We are very grateful to all of you, students and participants, for joining us in this work. And thanks also to the partners who have made this possible. Let's keep working, as I've said. Thanks to AfriHealth, our organization, for allowing our platform to be used for this wonderful work. Thanks to all of you. We will share the recording, as we've said, with all of you. And we'll also share the slides. We'll ask Doc to make the slides also available so that we can share that also with you. And you can continue with the awareness. Let's continue with the awareness. Tell people not to hide, and they should come out. We need all people alive. Thanks so much to all of you, and I wish you a wonderful weekend.
Thank you so much. Thank you, thank you, thank you. It has really been great. And just like you've said, we need to dispel the myth. We are living from here as ambassadors to see that we change the narrative for breast cancer. Thank you for your attendance, and I wish you the very best. God bless you.
Thank you. Thank you.
Thank you, everyone.
Thank you.
Thank you and
Have a
bye-bye.
great evening.
Bye.
Bye-bye.
Thank
Merci.
you.
Thank you. Bye-bye.
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 Thank you.
Thank
Goodbye.
you.
But
Bro.
for
Thank
student,
you.
this link doesn't work.
Bye-bye. Thank you. Bye. Thank
Please, if
you.
you have not given us feedback, remember to give us feedback. Please don't forget to go without giving us feedback. We really need your feedback.
For
Okay.
registration for member, student
good.
doesn't work.
Okay, there's a problem with the registration link for students. So we will notify you if we rectify the problem, but keep on visiting the website. Maybe tomorrow you try again, maybe it will be working tomorrow.
Thank you. Thank you. Goodbye.
If you join through
Goodbye.
AfriHealth, send the
Bye.
information to the student community.
Yes, I've shared the link in the chat, but they are saying it's not working. So I was actually encouraging you to check again tomorrow maybe. Yes.